Welcome to the Dr. UUT channel. Let's proceed the lecture in English. Disease control. We can control the disease by preventive measures. Let me clear the term by example. Malaria is being caused by the mosquito. Now, if you start living in an area where there is no mosquitoes, or if you start living in a mosquito net, you start sleeping in that, okay? Now you stop the mosquitoes to reach you. Female anopheles responsible to cause the disease malaria. Now if mosquito is not going to reach you, then you are not going to have disease malaria. So you got, now by means of these actions, you started living in the area where there is no mosquito. You are now living in a mosquito net. So like this you prevented. Now these measures you took means the measures. You are living enough in the mosquito net, this is a measure. You are living in area where there is no mosquito approach, that is also a measure. So like this, these are the steps. These are steps by which you prevented the approach of mosquito. They are known as preventive measures, and like this you controlled the disease known as malaria. So another example, AIDS. Now what are the preventive measures to avoid AIDS or to control the AIDS disease? Suppose we have a lot of examples by which the AIDS is caused, but the very interesting example, that is free sexual contact, which can promote the AIDS. Now you are going to control this disease. So for that you are going to have preventive measures. What is preventive measures? Now if you start if you avoid the free sexual contact, so you can somehow prevent the disease. So this is your preventive measure that you are taking. You are avoiding the free sexual contact, so you are preventing the what? Preventing the disease, controlling the disease, and this is your preventive measure, that you are not doing the free sexual contact. Okay, clear. Immunization. Immunization is what called, this is called to activate the immune system. So this can be activated by means of the vaccination. If you introduce the vaccines into the human body, which is going to activate your immune system, that is called, one is called vaccination. By means of vaccines you are activating the immune system. This process of the activation of immune system is called immunization. Now what is vaccine? Vaccines are actually the dead antigens that are introduced into the body. When your body senses that you have got antigens, and those antigens are dead, by the way, they are dead or living. So if those antigens enter the body, then your immune system starts making the antibodies. So now in the vaccination we are actually introducing the dead antigens. Now dead antigens will give signal to the body, to the immune system. Immune system will make the antibodies. Now antibodies against these dead antigens, they will have a fight. No, they are already dead. So then this once your body or your immune system gets the signal of a certain type of antigen, then the complete system is activated, and your complete body will make the antibodies. Means your immune system will make the antibodies. Like this your body will become immunized. So this mechanism is called as immunization. Whenever, if in future again that antigen is entered into the body, or gets a kind of entry to the body, then you have immune system, you have antibody against that. So this antigen that is going to enter, now you already have antibodies. So then if already a kind of army is available, so then enemies cannot enter, and the army is going to take that and to kill that. So this is called immunization. Drug treatment. You can control a disease by means of a drug treatment also. You can use antibiotics to control the disease, and you can use somehow chemotherapy to control the disease. So these are the basic steps: preventive measures, immunization, drug treatment, by which you can do what? Controlling of the disease. Hope so you got.